I tell people that sleep is a pillar of health. Just like diet and exercise, it is the other main contributor to our health and well-being.
We know that one thing that keeps people up at night is money. Do you have any tips for people on reducing stress?
Getting better sleep will also make you more efficient at work, lead to less errors. If you're on a RVU pay scale, you could ultimately boost your revenue.
Perfect. Welcome to Financial Clarity for Doctors, everyone. I'm here, Rochelle Vanderzanden with Corey Janoff, as always. And today we wanted to talk about something we all could probably use a little more of, which is sleep. And specifically how getting your much needed rest can help you improve your well-being and efficiency at work, which will hopefully help improve your finances too. Corey's actually going to introduce our guest today.
Yes, we have a special guest with us, Dr. Brandon Peters. Say hi, Brandon.
Hi.
He's a board-certified physician in both neurology and sleep medicine. Currently practices at Virginia Mason Medical Center in Seattle, Washington. And he's written a book. He's written over 1,000 articles on sleep. He's created a 6-week self-guided program to help solve insomnia. You can find many of his articles at verywell.com and more information on him and his work at brandonpetersmd.com. With that, welcome to Financial Clarity for Doctors, Brandon.
Thank you. It's my pleasure to join you.
Yeah, thank you for being here. And as we mentioned, we wanted to talk a little bit about healthy sleep habits and tips for physicians who may not have the luxury of a consistent schedule like some people do. We also want to briefly touch on sleep tips for parents today. So we're going to touch on that quickly. And I know you have some firsthand experience with that recently, Brandon.
That's true. That's very true. So we have a newborn who's 11 weeks and is sleeping through the night. So
that's amazing.
Of course.
That's an accomplishment.
Yeah.
Before we jump into a whole lot of specific questions, do you want to just throw some stats or data our way to maybe help people get motivated to get better sleep?
Yeah, so I tell people that sleep is a pillar of health. Just like diet and exercise, it is the other main contributor to our health and well-being. If you do not get enough hours of sleep or do not get a good quality of sleep, you're certainly going to be impacted in your daytime function. And for adults, the average sleep need is in the range of 7 to 9 hours. If you are under 7 hours, it's pretty unlikely that you're meeting your sleep need. Very few people, perhaps less than 2% of the population, can function well in under 7 hours of sleep. So for everyone else, it means they're sleep deprived, and that's going to affect concentration, attention, memory, certainly mood, with impacts on anxiety, depression, and irritability. And then long-term, it has impacts on other aspects of health, certainly increases the risk for cardiovascular disease, high blood pressure, increases risk for diabetes, and even there's some evidence that sleep deprivation can affect cancer risk. There was a recent study just last week on increasing the risk of cancer in women, breast cancer. There's been other studies that have found increased risks of colorectal cancer. So there's lots of good evidence and a growing body of research that supports the real importance of sleep to both health and long-term well-being.
Yes. What are some common healthy sleep habits that people should be practicing?
So generally, you should try to meet your individual sleep need on a nightly basis, and that sleep need can change throughout life, but you hear the average of 8 hours. That's kind of the middle of a bell-shaped curve. Some people need a little bit more, and some can get by on a little bit less. If you find that you fall asleep very quickly within 5 minutes, that you sleep deeply, don't remember waking up, maybe you wake up feeling unrested or unrefreshed, and are prone to sleepiness during the day, taking naps or dozing when you're sedentary, you're probably a little under on sleep, or your sleep quality may not be normal. And that certainly can be impacted by sleep disorders like sleep apnea or other conditions. But get enough sleep, number one. Number two, prioritize sleep. So make sure that you're keeping a consistent sleep schedule as best you can. Now, certainly physicians who are shift workers may have to accommodate that. But the ideal would be to have a consistent schedule day after day. And if you're working nights, that you do the best you can to keep to that schedule even through your days off and weekends. Light exposure in the morning is very helpful to set the circadian rhythm. So if you're someone who's sleeping overnight, First thing in the morning, getting 15 minutes of sunlight right when you wake up can help set your circadian clock. That will make it easier to wake up and also easier to fall asleep. Now, I live in Seattle, so it's very rainy and dark in the mornings these winter months, but that's something that will become easier for us to do in the spring and summer. I advise people also to try to minimize caffeine and alcohol consumption late in the day. The half-life of caffeine is 4 to 6 hours, so you want to cut that out by mid-afternoon. Some people are not overly sensitive to it, but it's probably still helpful to reduce consumption late in the day. And then alcohol takes roughly an hour for an alcoholic beverage to be cleared from the body. You want to cut out alcohol at least a couple hours before going to bed because that can impact your sleep as well. I think regular exercise is important. You don't want to exercise in the last hour of the day, but earlier in the day, getting aerobic exercise and keeping your weight in check is helpful as well. I think any of those things will help generally your health, but all of them will certainly affect and improve your sleep.
Makes sense. Is there a difference between like insomnia and just being a poor sleeper, or is it kind of the same thing?
Yeah, there's a lot of overlaps. Insomnia is by definition difficulty getting to sleep at the beginning of the night more than 20, 30 minutes, or waking in the night with that amount of time getting back to sleep, or early morning awakenings and unrestful sleep, so feeling fatigued often during the day. Those symptoms, if they happen for at least 3 nights a week and last for more than 3 months, we call it chronic insomnia. Now, someone can have poor sleep and not complain of difficulty either getting to sleep or getting back to sleep. They might say that they're a light sleeper or that their sleep's not restful, they're having sleepiness or other symptoms. And that generally would point us towards other sleep disorders like sleep apnea. And from my own experience, there's a lot of overlap between insomnia and sleep apnea. Many people have insomnia because of sleep apnea. They wake a lot during the night or feel unrested by their sleep because of sleep apnea. So it's good to have a formal evaluation if you're having persistent poor sleep. Often you can make behavioral changes, which we would teach as part of an insomnia program, a therapy program. And if you make some adjustments and find that you're sleeping better, then we wouldn't do further assessment.
Yeah, can you talk a little bit about that program? I think it's the cognitive behavioral therapy for insomnia program that you created.
Yeah. So the best treatment for long-term chronic insomnia is that program CBTI. It's generally delivered through the help of a psychologist or medical doctor who's trained in that therapy. It's a 6-week program, lots of education on normal sleep, things like sleep drive and circadian rhythm. You track your sleep patterns and then use that information to make adjustments to your sleep schedule. It might mean going to bed later or getting up earlier. Cutting out naps. And then there's education on managing stress and anxiety. Certainly physicians have a lot of stress, and sometimes it's hard to shut down a busy mind at night, and it would give you techniques to kind of distract yourself so you can get back to sleep or get to sleep quicker. And generally at the end of 6 weeks, most people who have completed the program no longer have insomnia. Many people that are using those techniques improve their sleep, even if they don't have insomnia from the baseline. And years later, when you check on people, they continue to sleep well, continue to sleep normally because they've learned a set of skills that help them to improve their sleep. Beyond in-person therapy, there are workshops, classes. That's how we do it here at Virginia Mason. There's an online course that I've put together, and there's a few others that are out there, and there are even books that are available. I have a new book coming out in the next couple of weeks called Sleep Through Insomnia that is based on CBTI techniques that someone could read through and apply those techniques to their own sleep.
That's exciting.
It sounds like insomnia, most people should be able to essentially cure it with healthy sleep habits. It's not like a chronic condition that can't really be solved, right?
Yeah, so I think generally if you can address the underlying causes, which may be stress related, may be related to anxiety, could be environmental, so a noisy sleep environment, could be related to other behaviors like consumption of alcohol, consumption of caffeine, or it could be often related to how much time a person's attempting to sleep. So that's a very common cause of chronic insomnia, where someone's not sleeping well, they go to bed early, or they had a bad night, so they turn off their alarm in the morning and allow themselves to sleep in a little bit into the morning, or they might try to take a nap during the day to try to catch up on sleep. So if you look at the math and say, okay, you're in bed 10 hours or 11 hours. I said, well, how much do you sleep? And they say, well, I sleep 7 hours, 8 hours if I'm lucky. It's like, well, if you're in bed that long and you're only sleeping 7 hours, you're always going to have insomnia. You're going to bed too early, you're getting up too late. And I kind of joke with them. I was like, this is not insomnia, it's math. You can't sleep 10 hours, and if you spend 10 hours in bed, you're going to be awake 2 or 3 hours. So we help them to kind of understand those changes and make adjustments. And most people respond to that and do well. I think the folks who struggle more are those who have untreated sleep apnea that's maybe unrecognized by the person that's experiencing it. Or another sleep disorder like restless legs that might be making it hard to get to sleep. So if someone completes CBTI and still is not sleeping well, generally we dig a little deeper with testing or look at some other options. Folks generally should not be on sleeping pills chronically. If you're taking a sleeping pill every single night for months or years, typically we've missed an opportunity to try to help you sleep better with other changes.
I feel like there's a couple of different things that we could dive into a little bit more there. But one thing I want to go back to is just stress, because you mentioned stress a little bit earlier. Mm-hmm. And we work with people and talk about money a lot. And we know that one thing that keeps people up at night is money. Like, do you have any tips for people on reducing stress or?
So, there's a few techniques which I think are helpful. It can be helpful to do an exercise called scheduled worry time, where you set aside time, typically at the end of your workday when you're reviewing the stresses in your life. And these might be, like you said, financial stresses. It could be relationship stress. It could be other family stress. It might be health-related stresses or other kind of professional work stresses. And you write those things down. So you're making a list of all the stresses in your life. And you're also trying to brainstorm and create some ideas that you could help resolve those sources of stress. So, for example, a stressor could be, I forgot to do my taxes. So your plan is to meet with the tax accountant, pay the penalties, pay the back taxes. You have specific things to accomplish in order to resolve that source of stress. And as you come back to that list each day, you're not going to generally add new stressors. That's going to be basically the same thing day to day. But you might accomplish some of those tasks and kind of work away at some of those stressors. And eventually, perhaps you get to cross off pay back taxes. You've accomplished something that was causing you stress. If you think about that at night, oh my God, I didn't pay my taxes. You say, no, it's on my sheet. I'm going to come back to that tomorrow. I'm not going to think about that right now. I get to go back to sleep. And you kind of put it aside and come back to it the next day. It's almost like a pressure relief valve. You get these things off your mind so you don't have to constantly think about them. And by working through them in kind of an organized, rational way, it gives you a sense of control over things that you may not otherwise have control over. There may be some things on that list that you say, gosh, I can't do anything about this. That's okay, too, to say, I've got to let this go. I'll come back to it tomorrow. Maybe something will have changed. But for today, I have to put it aside because it's just making me feel upset, and there's not anything I can do about it. So I think it's a very helpful exercise to use.
Yeah, stress.
It's interesting. I do find that when I'm learning something new, like that's something that keeps me awake more. So, like, because your brain is trying to learn a new task maybe or something like that. But I've definitely found that where you just wake up and you're worried about it. And really, it's like, okay, this is the nighttime. I'm not supposed to be thinking about this right now.
Yeah, and having a nice, what we call a buffer zone, an hour, maybe 2 hours before your goal bedtime, when you put aside your work and say, okay, there's more to learn, there's more to study, there's more to do, but I can't do anything more today. It's time to put that aside and spend that hour or two reading, watching a movie, watching familiar TV, so that you're feeling relaxed and sleepy when you transition to bed. That'll help you to fall asleep faster.
Yeah.
Fantastic. Being organized and structured helps you sleep better. And I feel like there's somewhat of a chicken and an egg deal going on here with stress and sleep. What comes first? I feel like, added stress can lead to lack of sleep, and also vice versa. Lack of sleep can probably lead to being more stressed about things that you maybe otherwise shouldn't be that stressed about. Can you talk about that a little bit?
Yeah, it definitely is what we call bi-directional relationships. So if somebody has both anxiety and depression and insomnia, typically it's best to focus on their sleep. If you help them to sleep better, that will reduce their anxiety, reduce their sense of depression. If you only focus on their anxiety or only focus on depression, but ignore their sleep, typically they'll continue to have poor sleep and their mood disturbance as well. And it's best if someone's in an acute stress situation, you give them skills to kind of work through that with the expectation that as time passes, that stressor will resolve and go away, and they can transition back to normal sleep.
This is kind of leads into one of the things we talked about with one of our previous guests, Jimmy Turner, the physician philosopher. He's talking about how he's able to get his finances in order, pay off a lot of debt, reduce his workload. I'm sure we didn't talk about it, but I'm sure that leads to him getting better sleep as well. Which it's only going to help, your financial picture. And I feel like, getting better sleep will also make you more efficient at work, lead to less errors. If you're on a RVU pay scale, you could ultimately boost your revenue. Have you seen any studies or data surrounding that?
Yeah, it's not well studied. Certainly there's a lot of studies looking into resident physicians and medical errors and all that goes with kind of poor sleep or kind of overworking, frankly. There were limits put in place to work no more than 80 hours a week, which still sounds like a lot to most people. But none of those limits apply to someone who's already graduated their residency and is in practice as an attending physician. So there's no evidence that someone gets better at being sleep deprived and that suddenly they can make fewer errors or have greater mental clarity just through kind of rote practice of being sleep deprived. There's no data to support that. And in fact, the contrary, that when you get better sleep, even one night of really good recovery sleep, there's an immediate benefit. People feel mentally clearer and sharper. They make fewer errors. And it could be errors in the surgical suite, or it could be errors typing their clinic note. And if you're inefficient because of a lack of mental clarity, you're going to be spending longer days kind of catching up on paperwork. You may make mistakes that ultimately prove to be costly with a malpractice claim. And professional athletes are kind of catching on to the importance of sleep and often have sleep advisors kind of coaching the team about how to adjust to jet lag and getting adequate amounts of sleep. And they get benefits. I mean, these professional athletes who are at the top of their game can run faster, can be stronger. I mean, there are benefits even among elite athletes. So I think the same is true for professionals and physicians, that if you can give your body the rest that it needs, you will function much better and come out ahead in the long term.
Do you have any good strategies for doctors specifically who are on call or have to switch back and forth between day shift and night shift, like making those kinds of adjustments?
Yeah, it's tough. The best thing would be to keep a consistent schedule, and sometimes that can be accomplished with creative scheduling. So like an ER physician who may be having rotating shifts and work nights or work a late shift, it'd be best if they kept on that late shift for a month and then switched to a new shift, rather than having a shift that's rotating across the week or across several weeks. Then they can fall into a circadian pattern that would help them to sleep a little bit better, and then they could kind of switch or ease off of that. If you are working nights, it's best to avoid light coming home in the morning and to immediately try to get into bed and to go to sleep. Blackout curtains or eye masks, earplugs. I mean, there's different techniques that can be used to try to enhance the sleep experience. But yeah, it's ideal if you can kind of lock into a consistent schedule. Now, if you said, well, I can't do that and I have this rotating pattern, certainly shift workers sometimes need sleeping pills or medications to help them be more awake during the day. But the ideal would be to have a consistency, even if it's a consistent nighttime work schedule.
What about docs who have to take call, like if you're an anesthesiologist or a surgeon or something, and you're getting called in during the weeknights and then every third weekend? Like, what do you do to cope with that?
Yeah, so I was on call last week, which admittedly sleep call is a little lighter than others, but I could get called by the sleep lab in the middle of the night, a question that comes up, or sometimes I get paged from patients for calling into the hospital operator. And so the week that I'm on call, my phone is in my bedroom. Otherwise, when I'm not on call, it's not. I don't have it at my nightstand. It's charging out in the kitchen as much as possible. If there's a disruption, somebody calls me in the night and I just need to talk to them, I'll typically keep the lights low, have a short conversation, and I generally sleep well, so getting back into bed, I'm able to fall back asleep pretty easily. If someone were to be called into the hospital, of course, that's even more disruptive because they have to wake up enough to be able to safely drive in and accomplish what they need to accomplish and then perhaps return home. I think you should still try to get at least 7 hours of sleep, even if it's broken up, and it might mean starting your clinic day or your work day a little later to accommodate disruptions during the night. Perhaps catching up a little bit with intentional naps, either over a lunch break or in the evening. Caffeine certainly can help people cope, but trying not to overuse caffeine because, again, that can be disruptive to sleep. So there's some ways we can accommodate those disruptions. I think ideally we would have protections personally, saying boundaries of our own schedules and what we're willing to do as far as covering call and our own work, but also professionally having some boundaries and trying to minimize disruptions to the sleep of our physicians, I think, is something that needs to have a higher priority among healthcare. There are really, frankly, not a lot of sleep emergencies. I don't need to be hearing from the hospital operator when someone calls in and says their CPAP machine is not working. There's nothing I can do to fix that machine. And someone called in the middle of the night reporting that their CPAP didn't work. And I said, you just call back in the morning. That this is not something I can help you with. So if there are certain guidance in place, I think we all sleep better if there's fewer disruptions, and putting off things that are not emergencies, I think, is important.
Well, that kind of gets back to, if you can get your finances in order, live below your means, you have a greater ability to say no. Like, you could take a job and say, hey, I'm not taking call. That's fine if you're going to pay me less, but I'm not going to do it. Or you pay some younger doctor to take your call for you. So there's definitely some strategies there if you've got some flexibility with the budget.
Yeah. And I think, and it extends to kind of when you start your clinic day, when you end your clinic day, whether you work weekend clinics, and certainly having boundaries. There is no limit to the amount of work that you can do. There is no limit to the number of requests you'll get for projects and things. I mean, at some point, you just have to say no, that you want to protect your own personal life, time with your family or friends, or your own health by ensuring you get enough sleep and enough rest to be able to function at your best.
Yeah, I think it's obviously residents and fellows just have so little control, but at some point they will have a little bit more control, and I think it makes a lot of sense to try to get your finances in order so that you guarantee yourself a little bit more flexibility when it comes to money and the amount of hours you work.
Yeah, and I think that's generally the balance people try to find, is the balance between wealth or financial stability and time. Mm-hmm. And I think as people become more stable, they often reclaim time that they'd given up in order to reach that stability. And I think in reclaiming time, obviously sleep is one of those things that gets supported more as you stabilize your finances.
Yeah. You mentioned sleeping pills a couple of times, and I know there's various different sleep aids that people try. I've actually heard about melatonin a couple of times recently. Do you have any opinions on what's more effective, what the dangers are, that kind of stuff?
So I have a unique philosophy towards sleeping pills, because most people who are coming to see me, the pills are no longer working. And I'm trying to transition them away from them, identifying kind of root causes to help them to sleep better. And I tell people, you don't take medicine to feel hungry. Why would you need medicine to feel sleepy? There are other techniques we can use to try to enhance sleep without needing to rely on the medicine. Melatonin is something your body naturally makes. It doesn't make very much of it, just like 0.2 milligrams is produced overnight. It does enhance sleep. It is associated with the nighttime, and I think it's okay to use. Most people are using it to induce sleep and would take it 20 to 30 minutes before their intended bedtime. You want to use fairly low doses, because higher doses might flood the system and you might wake up feeling hungover. Side effects are pretty benign. It's like increased dreaming, nightmares is probably the more common side effect. not a lot of people would say they get a profound benefit from using melatonin. So most people say, yeah, it helps a little bit. But if your insomnia persists, I would certainly move along to a different treatment. And insomnia therapy would probably be first line for folks who have troubles that last more than a couple of weeks. I think occasional use of a sleep aid is okay, especially if you're like experiencing jet lag or something. It's fine to use a transient use of a medication. But if you're using it nightly and using it for, again, beyond a few weeks, we probably need to be looking at some other options.
The transitioning here a little bit, a lot of our listeners and guests, such as yourself, have young children, which can be a kryptonite for sleep. So how can parents of young kids get their much needed rest?
Yeah, so it's a challenge. I have an 11-week-old son who is sleeping through the night. Last night, I think he was asleep by 7:30, 8 p.m., and he slept till 5:30 in the morning. But that's kind of unusual. I would say that only half of children will be sleeping through the night by 3 months. They have the ability to do that. And certainly early on, they're needing to feed every couple of hours, which means 2 or 3 awakenings to feed in the night. And of course, those last like 30 minutes, so you have big chunks of time that you're losing. It's tough. I mean, it really is tough. And I think don't try to be a superhero about it. If you need help, either from your partner or from family, certainly accept that help. It's good to have nights when you get a little reset. So even one night when you're able to sleep through the night and not have to be up for feeding is really great. And that might mean pumping breast milk and storing it in the fridge or using formula as a substitute. I think it's important to try to keep as regular schedule as possible and catch up when you can, sleep when baby sleeps. So if you can take an hour nap in the afternoon when the baby's down, that's a good time to try to catch up. If the child is not sleeping through the night beyond 6 months or certainly beyond a year, that often speaks to kind of how the parent responds to the child in the night. So most children may cry out, but if you leave them be, they can self-soothe and get back to sleep. If the child continues to cry out, it's often because they're getting something for that. They're getting attention or they're getting an extra bottle or something. So the parent will have to kind of need to retrain the child a little bit, which can be done typically over a short period of time, certainly within a few weeks. And the child will be able to sleep better through the night. It's also important for parents to recognize not every child's the same. You might have 2 children with very different sleep needs and abilities, and trying to force a child to go to bed early and sleep through the night and sleep through till 7 a.m. when that child maybe doesn't need that much sleep, you're going to kind of set yourself up for failure as the child gets older.
What are some good guidelines for kids and how much sleep they need at different ages?
Yeah, it really varies. Certainly older children, teenagers probably need anywhere from 8 to 10 hours of sleep. Younger kids often need 10 to 12, and certainly infants are going to take prolonged naps during the day as well. A child who's 3 probably is going to be consolidating their naps to just one nap during the day. But by school age, like 4 or 5, the nap tends to kind of fade away, and then they're just getting a solid chunk of sleep. It might be 11 or 12 hours kind of overnight. But I tell people, just like weight and height, there are percentiles for sleep. So not every child needs, let's say, 12 hours of sleep. They might be someone who can get by with a little bit less. And so if they're at a percentile of sleep need that's lower, perhaps that child only needs 10 hours of sleep. And by spending 12 hours in bed, they're going to be awake a lot in the beginning of the night or in the middle of the night because they're just being compelled to spend too much time in bed. So just like we do with adults, it's good to pay attention to their cues and pay attention to your own sense of whether or not they're sleepy. If they're not falling asleep for a prolonged period at the beginning of the night, it might be that they're just not sleepy at that point. Keeping them up a little later, half hour later, an hour later, might be enough for them to fall asleep more easily.
Yeah, I think the cues are sometimes challenging. Is the kid overtired or just angry for some other reason. You know, there's so many different emotions that those little rascals go through on a
Yeah.
daily, hourly. They change by the minute sometimes.
Yeah, and they don't necessarily know how to recognize those signals themselves, and certainly can't regulate as well as adults can. So yeah, and you just try to keep consistency. I think that's probably the best is having consistent bedtime routine, having consistent sleep experience. If you're recognizing deficit where you say, wow, they're awake a lot in the night, adjusting just like you would for other needs.
Is there a kind of an easy, for lack of a better word, way to tell if your kid is getting enough sleep or not enough or too much? Or
Yeah, I would say you want to try to match the amount of time they're sleeping to the amount of time they spend in bed. Older children, again, beyond the age of 5, really shouldn't be taking naps during the day. So if they are, that's probably a sign that they're not getting enough sleep at night. You also want to make sure they're not overly engaged watching TV, playing games, or whatever late into the evening, so that that's a reason they're sleep deprived. You want to kind of cool things down in the later evening hours, probably after 6 or 7, where you're reading, you're having bath time, you're kind of getting them feeling sleepy so they can transition to bed a little easier. Um, Children generally aren't overly sleepy during the day. They more often get hyperactive and can get diagnosed with ADD or ADHD. If the child has those kinds of symptoms, often we look at their sleep and make sure they get enough hours of sleep, but also make sure they don't have a sleep disorder like sleep apnea that might be affecting their sleep quality.
so they can, kind of like adults, if they fall asleep relatively quickly, then it's probably a good sign. If they're tossing and turning and fussing and up a bunch, maybe you're trying to force them to bed too early.
Yeah, they might be spending too much time in bed.
Okay.
And I've also heard that sometimes maybe they're just not getting to bed early enough. Like kids can get to the point where they're overtired and they have a hard time falling asleep.
Yeah, that definitely can happen too. Yeah, yeah, and they get kind of inconsolable about things. So yeah, and again, it's kind of figuring out. Okay, here's the expectation based on an age and population data. You're somewhere in this range most likely, and the same is true for adults. There's a range, and then figuring out kind of individually what is kind of the average. How much sleep are you getting in a 24-hour period, and then trying to keep a consistent schedule to meet that need. And it changes. That's the challenge, is that it changes as kids get older, and can even change in adults as we get older as well. But trying to match, and the same you would do with intake of food and appetite. You could overfeed a child and you can underfeed a child, and you're trying to find that sweet spot of they've got enough nutritional intake that they're meeting their needs and not going beyond that. Same with sleep.
And maybe to close things out here, do you know how sleep habits of children can affect them later in life?
So insomnia is pretty uncommon in children. Again, it tends to be behavioral because of how a parent's responding.
Yep.
Teenagers can get delayed sleep phase syndrome, where they become a night owl. That affects about 10% of teenagers, and light in the morning is very helpful for that group. Other sleep disorders like sleep apnea are fairly uncommon in children. Perhaps 2 or 3% of children have sleep apnea. If someone is persistently not sleeping well, certainly we would want to address it with either behavioral changes initially or sleep testing to look for other causes of poor sleep. There certainly are people who are predisposed towards a sleep disorder even from youth, and there are interventions that can happen in childhood that would actually give them long-term benefits, like treating allergies might help development and change long-term risk for sleep apnea, for example. So I encourage evaluation, always err on the side of getting checked out and getting tested. And if there's a disorder acknowledged, then treatment, I think, is something that's easy to engage in and kind of see how the child responds.
Do you know if there have been any studies done, to your knowledge, of like kids who are better sleepers or you know, later in life tied to either education achievement, income, job, anger, stress, whatever, like later in life? Have there even been those studies?
I don't think there's been a lot of long-term studies looking at that. Certainly, we could envision sort of anecdotally that would be true. When I was a college student, one of my projects, my honors thesis, was looking at sleep habits of college students and how that impacted GPA. And generally, students who had more regular sleep schedules and got adequate amounts of sleep had higher GPAs. And I was looking at two groups, psychology students and biology students, both lower level and higher level classes. And the patterns held that people who had regular sleep patterns and got enough sleep had higher grades. So, of course, that plays out in various ways, but we would expect long-term that they would continue to have either a personality type that allows them to protect their sleep, or in protecting their sleep, they get other benefits that give them long-term success.
Awesome. Thank you for all of your feedback.
Yeah, my pleasure.
Is there anything that we didn't ask that you think would be helpful for our listeners to know?
I think generally I would just advise people to honor sleep, that again, it is part of your health and your well-being, and there's no reason to shortchange yourself. I think the impacts are often neglected by the person who is experiencing them. They don't have insight into their impairments, and I think if you can consistently get a sufficient number of hours and a good quality of sleep, it will benefit your health and your relationships and your financial well-being beyond what you could imagine.
Amen. Any, aside from your website, anywhere else people should go if they want to find more of you or follow you, if you want them to find and follow you?
The only other thing you might check out is Twitter. I mostly share sleep information, but you can hop on there and I'll share articles that I've written or other content that I find that's interesting.
Fantastic.
And my Twitter handle is, remember, @BrandonPetersMD.
Excellent. We'll include a link to your profile. I follow you, so it'll be easy to find, but we'll include a link in our show notes. Well, thank you very much, Brandon. Appreciate the time.
Yeah, no problem.
We would love to hear your feedback and suggestions for future topics you'd like us to cover. You can get in touch with the show by emailing podcast@thefinitygroup.com or by following Finity Group on Facebook, Twitter, and LinkedIn @Finity Group LLC.
You can follow me on Twitter @CoreyJanoffCFP or on LinkedIn under my name, Corey Janoff.
You can follow me on Twitter @RochelleFinance or on LinkedIn as well.
Check out all of the podcast episodes on thefinitygroup.com/podcast or wherever you get your podcasts. And don't forget to check out our blog, thefinitygroup.com/blog. Thanks for listening to this episode of Financial Clarity for Doctors by Finity Group LLC.